Hey guys, Nurse Kat. We're going to talk about tracheostomies as one of your ICU skills in your ICU crash course. So for tracheostomy, you're going to monitor all the normal indications of good oxygenation, like respiratory rate, lung sounds, and oxygen saturation. There must be, at the bedside, an ambu bag, a little plastic obturator, looks just like the inside of a trach would if you poured plaster in it. Suction equipment that is set up and ready to use, and a replacement inner cannula comes in a little box. Those things should be at the bedside all the time. Next, look at your site, your trach ties, drainage. If there are loose trach ties, now's a great time to re-secure them. If there's a lot of drainage, now's the perfect time to suction. If the trach tube comes out, stay with the patient, calm the patient, call for assistance. Once the tube's been in place for more than 5 days, the stoma should not close or collapse easily. For acute dyspnea, first have the patient cough. If this doesn't clear the airway, remove the inner cannula. If that's what's plugged, taking it out and putting a new one in that you have at the bedside will fix it. If dyspnea remains, suction more deeply into the airway. These steps are taken very quickly, but call for assistance if you still have doubt.